My name is Dahlia Salman. I am a postdoc. I work with Professor Paul Thomas at Loughborough University, and I work for both triage and EMBA clinical trials to discover new biomarkers that could be used as new diagnostic tools in the future. Sure, triage is a multidisciplinary project. We have over 16 partners from all over Europe. Within Loughborough, we are working on clinical trials in collaboration with University of Edinburgh, Oslo and Sri Lanka. And what we're looking at is developing biomarkers for CBRN injuries to basically be able to create or develop non-invasive new diagnostic tools that first-line responders can actually use to establish and decide who's injured and who needs critical care ASAP, and who's the worried well and who's actually not very injured but maybe a bit of support can help in here. So that's the overall picture of the project basically. Now, you've asked me a question earlier about how do you do this, how do you detect nerve lesions in people. I'll give you one example. We look at pesticides, poisoning. When we do that in Sri Lanka, and what we basically do is that we capture patients that get admitted to the hospital after drinking a bottle of pesticides for various psychological reasons. And then we take samples from those patients over time. So we actually see the pesticides wash out over time. And that's basically what we're doing. Also, we're looking at radiological injuries. So how we're doing that, we're actually capturing cancer patients, various different types of cancers like breast, prostate or lung cancer patients who are receiving radiotherapy for the very first time. And they're receiving the right dose to treat their cancer. And what we do basically is that we collect the breath samples before radiation and then after radiation over time. And we are able to detect biomarkers that differentiate patients who had radiation and patients who didn't have radiation before. And we're also able to tell the dose of radiation that was given and the time when the radiological attack happened basically, or the radiotherapy was given actually. So that's basically what we're trying to do. For the triage project, we're doing both discovery and validation phases. So for the discovery phase, we're using the receiver, breath sampler, and we're collecting a sample we're collecting 4 samples per patient, and we're doing that over 6 hours. And we're doing this in Edinburgh, in Sri Lanka, and in Oslo. The same protocol, but we're also doing a validation stage and more of translating the biomarkers from the discovery phase to more of a sensor-based approach using the GC-IMS. So we're doing that as well. So we're doing both. We're doing the biomarker discovery and we're doing the translation to a sensor or a fast diagnostic test. So how we collect samples, we use the receiver, a breath sampler, and we collect one breath sample before radiotherapy, and then we collect 3 other samples after radiotherapy over 6 hours. And we also collecting 1 environmental, and we're collecting 1 air supply for quality control and assurance test. That's basically what we're doing. I find the receiver really useful. It's standardized. A lot of groups are actually using the receiver nowadays. It has sensors. You can actually control the pressure for that 1 sample, and you make sure that you don't have any leaks in that 1 sample. You also can decide what flow rate that you want to go with, what volume you want to go with. So in terms of sensors, in terms of technologies, it's great. So for the pediatric population, we actually use the receiver within the EMBA project. Which is a collaboration between Loughborough University and University Hospitals of Leicester. And what we're doing, we're looking at a range of patients, starting all the way from 7 years old to over 80 years old, and we're looking at any patient arriving to the hospital, admitted to the hospital with a breathlessness condition, whether it was asthma or pneumonia or COPD, heart failure, wheezing in children. So we're doing that over 2 hospitals, so you've got 2 independent sites. For the children clinic, we're using the receiver for that, and we're actually finding it we're actually finding that it's very it's feasible to use the receiver on the children, and we also found that it's acceptable by children. So we have a 7 years old who actually used the receiver to provide some breath sample, and I think that's great to start with. So yeah, so that's what we basically do it. I'm finding the Breath Conference really useful and actually very good as well. It's very similar to the Breath Conference that we had in Maastricht a couple of months ago, but the new thing into this conference is that we have a lot of the clinical team attending this conference, which is really important for clinical trials, for multidisciplinary projects. So far so good, I think, yeah.